Yeah, the link is it was noticed pretty early in the pandemic that there was like a high prevalence of POTS among these patients, the long COVID patients, and our research group was actually one of those who put the light on it with some case studies early on, like in 2021 or in the end of 2020. And then we just started to have like a follow-up procedure where we mapped the existence of POTS among our patients. And then at the end of that, we published this study showing uh, almost 30% prevalence of POTS among these patients. From the clinical perspective, we have noticed that patients with POTS, I mean the long COVID patients that are also POTS positive, have a slower, doesn't recuperate as good as the others. Um, it does post It does give additional symptoms with palpitations and another level of fatigue. And has also been shown in our study that they actually have a lower grade of rated health than the ones that doesn't have POTS. So it's like another dimension of long COVID. Well, the first thing is to actually just uh, diagnose POTS in those patients. So this is very rewarding to be able to publish a study where you can give clear and concise, just clinical recommendations in the conclusions. And this is one of the conclusions that any patient with long COVID that has heart palpitations or orthostatic intolerance, that is, they get worse when they get up from a supine position to an upright, should be systematically diagnosed for POTS because you will find it in approximately 30% of the patients. And it's important because sometimes there are medicines that can actually alleviate the symptoms. You can refer the patient to a cardiologist for the right kind of treatment, and also um, regulate fluid intake and salt intake, use compression garments and so on. And also in some cases discontinue aggravating medications. So it can actually be managed clinically to alleviate symptoms. We still don't know what it is. We don't know the pathophysiology is unclear as yet, but we do have some alleviating treatments for it, for the symptoms. Well, of course, larger studies. I mean, with ours is the largest study so far in this particular patient group, but larger studies are always welcome. Our study do mirror the results of prior smaller studies, but larger studies are always good. And also, health economics is one thing that needs to be penetrated to see what kind of cost does this pose for society, because long COVID is pretty prevalent. I mean, the latest studies, I think, uh, cites like a prevalence of almost 50% among unvaccinated hospitalized adults, and between 10 to 15% for the non-hospitalized patients that are not vaccinated. So if you take 30% of those and add POTS, then you have morbidity, a decent morbidity, and of course also a cost for society and great suffering for the patient.